everyone, I am Dr. Kasmi, and in this video I will briefly talk about breast cancer and what factors could increase or decrease the risk of developing cancer. This video is based on latest scientific findings. The resources of the information are given in video's description. Breasts could feel different at different times of month. Just before periods, breasts may feel lumpy. Pregnancy also changes the appearance of breasts. Breasts might become bigger, heavier, and feel sore and tender during pregnancy. Breast cancer is the most common cancer in women globally, but it can also occur in men. However, breast cancer in men is rare. Breast cancer is developed when cells go out of control in breast and start to grow and divide rapidly, that eventually form a tumor. Breast cancer starts in the breast tissue and is most common in the cells that line the breast ducts. Breast ducts are thin tube in breast that carry milk to the nipple. Breast tumor feels like a lump and often can be detected on an X-ray. Survival for breast cancer vary across the globe, but it is generally pretty good, particularly if diagnosis is made early because of improved treatment and as the majority of breast cancer cases are diagnosed early and at localized stage. That's why it's very important that women examine their breasts regularly, and if they notice any change, immediately contact your GP and get your breasts checked. Breast cancer risk can be affected by age, family history, and lifestyle factors such as obesity and smoking. Women who have one first degree relative like mother, sister, or child who was once diagnosed with breast cancer have almost twice the risk of getting breast cancer compared to those women who don't have a family history. And those women with more than one first degree relatives have seen to have 3 to 4 times higher risk of getting breast cancer. Risk of developing breast cancer increases with age, and women who are experiencing menopause have a higher rate of developing breast cancer because they are aging. Menopause is when women stop having their periods. There is strong evidence that vigorous physical activity decreases the risk of both pre and post-menopausal breast cancer. Many research studies have shown that women who are physically active and have a lower risk of developing breast cancer than inactive women. Similar reduction of breast cancer risk are seen among both pre and postmenopausal women. Breastfeeding reduces the risk of breast cancer in mothers, and the reduction of breast cancer again is similar in both pre and postmenopausal women. Consuming alcoholic drinks increases the risk of both pre and postmenopausal breast cancer. Greater birth weight also increases the risk of premenopausal breast cancer, while greater weight gain in adulthood increases the risk of postmenopausal breast cancer. During puberty, exposure to radiation from medical treatments like X-rays increases the risk of breast cancer. HRT, that is hormone therapy or hormone replacement therapy, containing estrogen with or without progesterone, increases the risk of breast cancer. Early menarche, that is when girls start their periods before they are 12 years old. Late menopause, like after the age of 55. Women who don't have children, and if their first pregnancy was after the age of 30 years, or increase the risk of getting breast cancer. So, to reduce the risk of developing breast cancer, please do exercise regularly. stop smoking, maintain a healthy diet and weight, and reduce the consumption of alcohol. This channel regularly posts videos on what the latest scientific research says about the things that we always wanted to know. So please stay tuned and thank you for listening.